everyone. I apologize for being in the car when I'm doing this, but when I record my blog videos, I'm kind of better at just winging it, so that's how I'm going to do this. My name is Jessica Franklin, and I'm 32 years old, and I'm a cystic fibrosis patient from Westminster, Maryland. I'm doing this video and starting this page to tell you my story and to get help in raising money to get my dental implants, which is a permanent solution to all of my dental problems that cystic fibrosis has caused me. CF, or cystic fibrosis, is a life-threatening lung and digestive disease that you're born with. There is no cure. I was diagnosed at age 3, and I really wasn't supposed to live past elementary school. Back then, they really didn't know a lot about it, and there just wasn't a lot of treatments for it. But I'm proud to say, like I said, I'm 32, and I fight very hard to stay as healthy as I can be, and I just kind of keep on trucking and getting through. There are a lot of other issues that cystic fibrosis can cause as kind of like a trickle-down effect, and dental problems is one of them. I have to say, let me get across that all of my dental issues are not because of a lack of taking care of myself or my parents taking care of my teeth when I was younger. I can brush my teeth, floss, do everything I'm supposed to do, and they're still going to fail, and I'll get to that in just a second. But there are some hereditary problems in my family that have contributed, but ultimately issues from CF and the medications that I'm on to treat CF have caused these issues. When I was 4 years old, I remember all of this started, and I had major surgery to fix a lot of cavities and a lot of other issues I had with my teeth, and from then on it's just been a constant ongoing battle, and at this point it's a losing battle. Sorry. I cannot even begin to explain how many fillings I've had. All of my teeth across the top and most of the bottom are not my real teeth. They're mostly filling, and they're still failing. I've had 3 extractions, 2 root canals, and the financial burden that has come along with that has not been easy. When you have cystic fibrosis, there's already a ginormous financial burden that comes along with that. So I get as much assistance as I can to help pay for all my medications and medical supplies and doctors and hospital stays and everything. But none of it covers dental. Even as a kid, none of it covered dental. And I was lucky enough as a kid to have a great-grandmother and a great-aunt who was willing to take on that financial burden to keep my teeth as healthy and straight and filled as possible. They both passed in 2004, and then that financial burden became mine. I'm on a fixed income because of cystic fibrosis. I'm on disability because I cannot work and take care of myself. It's way too much. Taking care of myself is a 24-hour-a-day job. I don't get a break. I don't get time off. I don't get vacation. I have worked. I have a college degree, and it just didn't work out. My health is way more important, and when I tried to work and take care of myself, I ended up in the hospital. I run myself into the ground. But anyway, so when I had to take on that financial burden, it became harder and harder to keep up with cleanings and getting what teeth I need to get filled. And at this point, my teeth are flat out failing. I've done so much to try to fix them that there's just no fixing them. It's becoming a waste of money. What money I have spent, I should say. In 2010, I did go see a cosmetic dentist because I thought, and she had thought, that if I fill all of my teeth and get veneers, that this would solve my problem. However, I could not have been more wrong, and neither could she. I never finished this process. I ran out of my money limit that I financed with my grandfather, and I still have teeth that need filled, teeth that are decaying, that are broken, teeth that would probably need pulled at this point. Lucky enough they're not infected. Sorry, it's just a lot of information I'm trying to spill out here. When that happened in 2010, I took on a $10,000 financial burden for that, and it never got finished. And I'm finally just about to pay this off in May, and I ended up getting taken to court for it because I hit a hardship, and I missed 1 month, and the company that financed it took me to court, and that was that. And because I didn't want to mess up my grandfather's credit, I have devoted half of my disability check to cover that bill to pay it off, which has been the last 32 months of my life. So the struggle has been real. But anyway, let me kind of back up for a second and get to why all of these teeth problems happen because of CF. When you have CF, you have vitamin D deficiencies, mineral deficiencies, calcium deficiencies. You can have bone loss. I have the beginning stages of osteopenia, so I already have bone loss. I have degenerative disc disease. I have a lot of back problems. And ultimately, all of my vitamin D and calcium deficiencies has caused that to wear onto my teeth, along with my medications. When I was young, my capsules that I need, my medication that I need to take when I eat, they couldn't be swallowed. So my mom would break them open, my enzymes open, and put them into applesauce or some kind of soft food that I could swallow. And they ultimately ended up staining my teeth a bright yellow. My grandmother took on that burden right before my senior pictures to get them bonded and whitened for my senior pictures, which God bless her for. And the other thing is, all your breathing medications that I'm on 4 different nebulizers, I have an inhaler, everything just kind of sits on your teeth, no matter how much you brush them, how much you floss, how much you do, whatever you could think of to take care of your teeth. Your medicines are just going to ultimately end up breaking down your enamel, causing decay, and that is exactly what ended up happening over and over and over, constantly, my whole life. And when I thought in 2010 that all of this was going to get fixed, I'm glad it kind of didn't go through with it, because it still would have failed, and it still would have been pointless. At this point, I have most of my bottom teeth haven't been filled in years. They're breaking, they're decaying. My teeth up here that have been filled are turning black up top and falling apart. I honestly spit out a piece of my tooth while I was brushing my teeth the other morning. It was ridiculous. It's embarrassing. It's a really big self-esteem issue. I'm usually a very bright, happy, outgoing person that loves to smile, loves to make other people smile, and I don't smile as big as I used to because I'm getting sick of getting called a drug addict and people saying that I don't take care of myself when I do. And honestly, as very blunt of a person as I am, I'm just quite frankly getting sick of defending myself. I shouldn't have to defend myself. You shouldn't judge somebody like that without knowing the story behind it. And I just want a permanent solution, because ultimately they're failing. My teeth are failing, and if they get infected, that's ultimately gonna affect my overall health. And we all already know that I have enough health issues as it is, having cystic fibrosis. I don't need an infection going into my bloodstream. I don't need any other issues that can come about with it, and I just need a permanent solution. And so on March 11th, I went and got a dental consult to get dental implants. And I want to be clear by saying that people have suggested dentures. People have suggested dental school because it's cheaper. I don't have money. My family doesn't have money. It's costly. I barely get by. You know, some days I have to debate between shampoo and food. You know, it gets that bad sometimes. I can't do dentures because they ultimately are not a permanent solution. They end up causing bone loss over time. I already have enough bone loss. I don't need any more of that. You have to get them readjusted as you get bone loss. It's costly, and it's still not a permanent solution, like I said. So I went to get a consult for dental implants. I don't trust a lot of dentists because of bad experiences over the years, which is why dental school is out as well, besides the financial burden. these people, I went to Clear Choice. I know it's kind of an upscale place, but I trust these people. I'm comfortable with these people. But the figure I got to fix my whole mouth, because at this point the prosthodontist said there's no saving my teeth. So to get a full mouth fix, I had about a mild stroke when they told me it was going to cost $50,000. Now I know my page does not say $50,000. That's a lot of money I feel to ask for. Even half of that, $25,000, is a lot of money to ask for. But I'm going to try to at least raise half of it so I can at least get the top half of my mouth done as part of a way to get this started. I need your help, guys. I need to get my teeth fixed. They're failing. They're falling apart. I don't know what else to do. I came home crying that day from the consult because I didn't know how I was going to pay for this. And I want my teeth. I want to be able to smile as big as I used to. I want to feel good about my appearance. You know, I have enough issues as it is. One more issue just isn't one more thing that I should have to deal with, or anybody in my position should have to deal with. There's a lot of CF patients in this country going through the same thing right now, and I feel bad for them because I know what it's like. And if you could just donate $1, $5, if you could share my page, if you could spread the word, I really just want my smile back, and I want a healthy smile back and a permanent solution. And they can do it all in one shot, all in one day, and I can leave with a smile the same day I go in. And I'm really asking you guys, can you pray for me? Can you pray for this to be a success? Can you help me out? Like I said, $1, $5, whatever you want to donate, I don't care. Spread the word, and I really hope this is a success, and I really hope that that I can get my smile fixed so I can smile as big as I used to. See you later, guys.